This visualization plots every death worldwide in a single year. Out of the total, we can isolate a cluster of 19.8 million individual data points. That represents 32% of all global deaths in 2022, and they all share a single cause: cardiovascular disease. Despite the scale of these numbers, there is a pervasive assumption that heart disease is an inevitable consequence of genetics and aging. The biological reality is that cardiovascular disease is driven by modifiable risk factors. Conditions like obesity, type 2 diabetes, and hypertension act as the primary catalysts for the disease. Because these conditions are largely dictated by lifestyle, major international health guidelines point to one primary, non-pharmaceutical intervention to modify risk: the diet. To survive the world's leading killer, we have to look at how specific foods directly alter the environment inside ourselves. To see how that alteration happens, we have to look inside a healthy human artery. The inner lining, the endothelium, actively regulates blood flow. A diet heavy in saturated fats and refined carbohydrates rapidly spikes LDL cholesterol. These particles embed into the arterial wall. The cholesterol oxidizes, and the wall swells inward, forming a dense plaque that physically restricts blood supply. Atherosclerosis is a physical remodeling of our blood vessels, directly fueled by the specific macronutrients we ingest. Tracking another gut microbiome risk factor: when we consume animal products, local microbes metabolize them into a byproduct called TMAO. Once released into the bloodstream, TMAO triggers inflammatory responses and alters cholesterol metabolism, directly promoting thrombosis, or blood clotting. The biological mechanisms of defense are equally direct. Omega-3s and polyunsaturated fatty acids improve the vessel's ability to relax and prevent systemic inflammation. Similarly, soluble fiber from complex carbohydrates reduces the progression of atherosclerosis, while antioxidants shield LDL molecules from oxidation. We possess specific microscopic agents of both destruction and repair. Both are sourced from our diet. Biological mechanics explain the internal process, but clinical reality is proven through large-scale human data and randomized controlled trials. Observational data shows vegans maintain significantly lower LDL cholesterol than omnivores. To address hypertension, we can limit sodium to under 2 grams a day and utilize functional foods like beetroots, garlic, oats, and leafy greens, which are proven to lower blood pressure. To manage cholesterol, the strategy involves fiber from whole grains like quinoa and oats, while replacing saturated fats with whole food sources like nuts, seeds, and avocados. For chronic inflammation, we can flood the body with antioxidants found in berries, cruciferous vegetables, and beans. These ingredients act as specific biological countermeasures designed to neutralize the dysfunctions that cause heart attacks. The counterpart is what we must eliminate. Red and processed meats, like bacon, sausages, and salami, contribute to vascular damage and must be removed. Secondary guidelines include cutting out refined carbohydrates and sugar-sweetened beverages, while moderating or eliminating other animal products like poultry and dairy. When relying primarily on plant foods, it is necessary to supplement nutrients that are no longer provided by animal sources, specifically vitamin B12 and vitamin D. Dietary intervention is progressive. Every step toward maximizing high-quality, whole plant foods yields measurable cardiovascular benefits. The biological data for preventing cardiovascular disease is established. The intervention required to address the world's leading killer is a matter of daily dietary choice.